I would like to demonstrate interoperability using practice today. In short, I will take a patient's entire electronic health record and wrap it, post it to the patient portal, transport it securely to another provider, unwrap it, import it, verify it, reconcile it, and use it in the target EHR machine. I will define entire electronic health record as all user-facing information. That includes the following 34 data components. Let's get started. I will first select a patient record, medical records, care document. We will create a care document using the CCR Plus format. Let's view. You can see the document looks very similar to the CCR that was originally introduced with ONC Stage 1 certification. We'll call this new rendition the CCR Plus, which stands for Comprehensive Care Record. The CCR Plus has the same bone structure as the original CCR, but those bones have undergone a significant upgrade to address the changing times of healthcare. The style sheet has been totally reconstituted. The XML schema has been completely overhauled. The only vestige of the old CCR is probably the color scheme. I will scroll through the CCR Plus so that you can see all the data components. We have the header, patient demographics. Notice this includes a patient photo. Table of contents. It's alphabetized and link enabled. If we click on medications, we're taken to medications and easily returned to the table of contents. Summary. This is a brief introduction prepared by the provider detailing the most important points about this patient. Notice how it's right up front, so it's the first component you see when viewing the CCR Plus. Past medical history. Notice there's a link for the person who prepared each history detail. Discharge instructions. Notice how formatting is preserved. That's very important for presentation. Alerts for allergies, adverse events. Advanced directives. Support providers. Here you see a link for each support provider. If you click on the link, you're taken to their detail in the people component. Functional status. As we go along, notice how we include coded information. ICD-10, SNOMED, CPT, LOINC, RX norm codes are always presented when available. Problems. We have both the problem list and the diagnoses. Insurance claims. We include CMS 1500 Box 24 information for each claim line item. Medications. Notice the column that says Show More Details. As with any style sheet, sometimes there's simply not enough room on the line to display everything, so information goes missing. Practice today handles this differently, especially for medications. If you click on Show More Details, additional details are displayed. This is important, especially if you're doing electronic prescribing. Click Hide Details to return to the original view. Medical equipment, immunizations, vital signs. Notice how we alternate line color to make it easier to follow the information across the page. Encounters, encounter notes. Again, notice the alternate color scheme to quickly identify each component of the note. Hospital admissions. It includes a link to the facility details, and notice the coded entries. Social history. We include the full slate. Notice that we track multiple languages, and we have a separate line item that indicates the primary language. This is done for race as well. Family history. Again, coded information for each family member. Lab results for custom data gathered in the office. Lab results for data received from a laboratory in HL7 format. Patient-reported information. We include information gathered from the patient when a history is taken. Questionnaire. These are responses to specific questions that are useful in decision-making. Insurance payer. We include primary, secondary, and third position payer information. Identification cards. The scanned image is important. Notice how both the front and back are presented. We can show card images for the patient, all subscribers, their driver's licenses, and their Social Security cards. Miscellaneous documents. Here we can include any type of file associated with the patient record. This CCR Plus includes an audio recording prepared by the provider discussing the initial visit. If you click on the link, the audio file is played. You can also include radiographic images that can be launched with a DICOM viewer. You can include any type of file except for executables, of course. They present problems with your virus scanners. Care plans. Healthcare providers. The CCR Plus can include every provider that touched the patient record. Notice the link that connects to the provider's detailed info in the People section. Financial credit and auto information. Why would we include this in a patient's health record? Because it's not just a health record, it's a comprehensive care record. That includes elements outside the health spectrum. For example, if this patient account goes into collections, you now have an instrument to convey all information about this patient to the collection agency to collect your hard-earned money. Student information. People. This section presents info for everyone referenced in this CCR Plus. Name, occupation, relation, date of birth, ID numbers, phone numbers, addresses, and emails. Organizations. This section presents information for every organization or facility referenced in this CCR Plus. Notice the OIDs. OIDs are incredibly important if interoperability is to work as we would like. The OID allows us to uniquely identify an organization within our databases. It eliminates the problems of redundancy and record matching. Information system. This identifies the software that prepared this CCR and the version number. I've taken time to review each of the 34 components of the CCR Plus because I believe you must first embrace the instrument of interoperability if interoperability is to thrive. The CCR Plus displays your data in a format that is clean, clear, concise, and consistent. But most importantly, the data you see in the CCR is the very same data the recipient receives. What you see is exactly what they get. Unlike the CDA, where there is a human-readable component and a computer-readable component, which may or may not be the same data. The CCR Plus is a happy format. It doesn't start out with a header full of performer, legal authenticator, document ID, or maintenance nonsense. The CCR Plus header presents a patient photo, easily identifiable patient demographic, and it clearly states the date created, from, to, and purpose. Did I mention that the table of contents is alphabetized and link enabled? Yes, I did. Now that we have created a CCR Plus, let's zip it and upload it to the patient portal. Click Zip. We will upload using the admin panel of the patient portal. Access the admin panel. Click Upload Summary. Browse. Select. Open. And done. That was a total of 4 keystrokes to deliver the CCR Plus to the patient. Done. Done. Let's peek at the patient portal to see the rendering. We will log in as the patient, and here's the CCR, presented front and center, and the patient can easily download it. Now back to demonstrating interoperability. I'm going to take 10 seconds to regenerate the CCR Plus using a slightly different style sheet that will be useful for the recipient provider to reconcile her data. I will select the secondary style sheet, click Create Document, and zip. Let me take a second to show you the CCR using the secondary style sheet. It is basically the same, but notice the checkbox for each data item. This will allow the recipient provider to pick and choose which pieces of data she wants to import into the target patient's record. We are now ready to sign, encrypt, and send the payload.